Right now, let's go to Richard Ragan. He's the country director for the World Food Programme in Bangladesh. Great to have you on the programme. First of all, I hope where you are hasn't been too badly hit or affected by the cyclone. In South Asia, who are the people most at risk from the COVID-19 pandemic?
Hi, thanks, Maria. Just to give you a sense of scale in Bangladesh, we have, roughly the mortality rate here is about 5,000 people die per day. And, we've only had slightly over 400 corona deaths since the outbreak happened here, and we've been locked down for over 2 months. So, just to sort of give you a sense of perspective, there are around 40 million people out of the 170 million people in the country who are already living below the poverty line. And we at the UN World Food Programme think that with these lockdowns, another 20 million people have been pushed into poverty. So that gives you a sense of scale, when you look at the impacts of the virus versus the economic consequences of the lockdown.
That's an incredible number. Another 20 million people pushed into poverty. And that was my next answer. Is the pandemic a bigger threat or is starvation the bigger one?
Well, in South Asia, the dynamics are very different from what you're seeing in, Western Europe and North America, where it's really been sort of a health crisis response. Here, we're certainly seeing the immediate economic impacts of it. And now you mentioned when you opened the cyclone that's bearing down on us, we've got Umpan, which is started off as a super cyclone, a Category 5 cyclone in the Bay of Bengal. Fortunately, it ended up as a Category 3 cyclone, but it's still also landing on us at the time, of coronavirus. We've had to, in Bangladesh, the government has relocated nearly 2.5 million people away from 19 districts that have been impacted by the cyclone. So you're having to move large numbers of people when in an environment where you should have social distancing, and you're moving them into, cramped cyclone shelters. So, this is really almost an impossible issue to deal with for places like Bangladesh.
And how do you do that? Just a question on that. How do you move so many people into shelters and keep social distancing when there's COVID-19?
Well, the government is really good at this. They've been facing disasters since the country was born in 1971. It was really born during one of the most horrific cyclones that it's faced. So they've gotten good at it over the 50 years that the country has been a country. In this case, for example, the shelters have a special room for people who we think are COVID positive, and they're screened as they go into the shelters, and they're moved out of the more general population. But it's a super big challenge. My organization, the World Food Programme, along with some other UN agencies, are also managing the Rohingya refugee crisis. So we're feeding nearly 1 million Rohingya refugees every day, and they're in what is the largest refugee camp in the world, and trying to maintain social distancing and provide services to that really cramped facility is almost an impossible task as well.
And talk to us about the Rohingya very briefly, because over 1 million people. How do you help these poor refugees there?
Well, in terms of trying to limit exposure, for food distributions, we've cut the number of people who turn up at our outlets to pick up food to half. So we're doubling the number of distributions we do to keep bigger crowds from showing up at these sites. We're also doing much more home delivery. So for the elderly and disabled.
Richard, we've run out of time, I'm afraid. I'd love to hear more about this. Richard Ragan from the World Food Programme, wish you the best of luck with your work.